welcome to Leaders of Tomorrow on ET Now. We bring you expert advice on anything and everything that matters to you, whether you are a small business, a young entrepreneur, a student, or just an enterprising Indian. On the show today, I'm in conversation with someone who's entirely a self-made entrepreneur scaling his hospital to becoming one of the largest when it comes to oncology care in the country. I want to welcome in Dr. Peddireddy Sridhar, CEO Omega Hospitals. He's also the MD at Renova Hospitals. Dr. Sridhar, so good having you joining us here on the show, talking really about your journey, 2 decade plus journey is what you've had as far as the healthcare services is concerned. To start today's interview, I just want you to give our viewers a brief sense of what that journey for you has been like, scaling Omega Hospital, scaling really the brand into becoming the second largest in India when it comes to oncology care.
I have joined India's one of the largest tertiary care hospital called Nizam's Institute of Medical Sciences in 1998 as admin trainee. After working there for 6 months, I realized that I need to understand healthcare more from grassroots level, for which I thought I should do some work in healthcare research. So I was looking for a good platform. I was lucky to get a break in an NGO called Institute of Health Systems, which had some great WHO World Bank projects. These projects gave me a lot of insight into healthcare, not just the projects, but I had opportunity to get trained under a great personality called Dr. Peddireddy, who is a doctor by profession and then did his IAS. After working there for 3 to 4 years, in 2002, when I thought that I am ready to come back to mainstream administration, I picked up oncology as my subject during that time. The reasons are two. One, in 2002, I was sure that next 20 years, oncology is going to grow leaps and bounds. So as a career, I thought it will be a good opportunity for me. Apart from that, I always wanted to do some work which will give me career satisfaction, also which will give me some platform to do some social service. I would say this is the biggest break in my career, because when we started Omega in 2010, oncology was a new subject. It was an evolving subject. Especially if you look at private hospitals, very few specialty private hospitals were available in this field. A lot of trust-based centers were there, but private hospitals were very less. So probably we have entered the market at the right time, and with the help of, as I said, talented doctors and under the guidance of Dr. Mohan Mamchi, we scaled up Omega Hospitals to second largest oncology chain in India in less than 10 years span. Then after working for 15 to 16 years in oncology, there were 2 or 3 other sectors which I wanted to work. So I picked up middle multi-speciality as one space, infertility as the other space. So I have started 2 new brands called Renova Hospitals under the middle multi-speciality and Ziva under infertility.
But I just want to take a step back and talk about what has been impacting the entire world as we speak, COVID. Thankfully, there seems to be, some relief in sight. But I really want to talk about what it has meant for those of you who are in the healthcare space. What this time meant, what being in a situation so unprecedented has really meant.
See, one thing I would like to tell you is that COVID has once again proven how strong, dedicated, and efficient healthcare workers, especially doctors, are in India. Why I'm telling this is, compared to a lot of developed countries, if you look at the number of cases India has dealt with in COVID, comparatively, if you look at the number of doctors and beds we had, maybe we would stand at 3 to 4 in bottom 3 to 4 countries in the entire world. But even then, our recovery rate has been one of the best in the world. Our mortality rate has been one of the least in the world. The reasons are manifold. I know government has done a great job, but one of the main reasons for this is the pool of talented doctors, pool of talented nurses and healthcare workers India possesses.
While we've been talking about what has happened across the impact that COVID has had on the healthcare space, specifically with regards to the area that you work in, you were very briefly talking about it in the lead up to this question. But can you give us more sense of what and why cancer care and COVID, that space and that area becomes just that much more critical?
As you rightly said, probably cancer patients were the people who were most affected during this pandemic. The reason is cancer is one disease which increases on day-to-day basis. It has a tendency of spreading to other organs if you don't get treated. Leave aside stopping, but even if you postpone the treatment, it is really dangerous for the patients. But what happened during the initial days of the pandemic is cancer patients were a little confused whether to go ahead with the treatment coming to the hospital or to stay at home and keeping them safe from the virus. Even as healthcare providers, honestly, for the first 2 3 weeks, we were a little confused on how to go about. But if you talk
Okay.
about Omega specifically as a cancer brand, what we did is we have taken a conscious decision that we are not going to treat COVID patients during that time. Now, if you go back to March, April, when COVID numbers were huge and other patients were not coming to the hospital for fear of cross infection or because of lockdowns, but in terms of numbers and in terms of money, hospitals would not have survived without doing COVID treatment. But even then, we thought
Okay.
as an oncology specialty brand dealing with patients with low immunity, we would not treat COVID. We would wait for patients whenever they come back, and we would give them a platform which is COVID free. So that is the first important step we have taken during that period. Secondly, we also followed from stringent sanitizing process, including laser process. We made sure all the patients are screened 100% before they enter into the OP. By doing this, what we did is we tried to check the cross infection between the patients. Other aspect which we did is the infection can come from staff to the patient. So we just tried to see what all areas we should focus in terms of giving safety to our patients. So we made sure all the staff had PPE kits. They were trained well in terms of how to keep them sanitized and clean. We gave them masks. And by doing this, we made
Okay.
sure the hospital is at least 99.9% COVID free. Now the next
Okay.
question is how do we train the people? How do we educate
Yeah.
them? So we sent some mails, we created some WhatsApp groups, and we tried to educate patients that if you don't come to hospital to get treated because of COVID, because of fear of COVID, then you would actually go ahead with facing a bigger problem in terms of cancer. So we tried to educate
Sure.
people, patients to come back to hospitals. We explained them what are the measures we are taking to keep them safe. Apart from that, we also trained them on how to keep themselves away from the virus. So these are the steps we have taken to combat this deadly pandemic, and we were successful in it. We could come back to
Okay.
normalcy in less than.
Okay, you're talking about COVID and cancer. You're also involved, and you were talking about this again very briefly. Mid-specialty and IVF. What has been the impact, if any, on both these specialties, and also just give us a sense of the size of the market. Has there been any impact in the terms of growth because of the pandemic? Give us a sense of that.
Yeah, I think I would like to start talking about oncology, which is my basic my initial sector where I'm working with. In oncology, the
Mm-hmm.
opportunities are only growing day by day. As you see, probably all of us know that oncology already has crossed road accidents to become second largest killer in India. As per latest CDC
Okay.
reports, 2017 CDC reports, of overall deaths, cancer contributed to 21.7%. If you convert them into
Sure.
numbers, 6 lakh patients, 6 lakhs people died with cancer in 2017. Whereas in just 1 year span, the number increased from 6 to 8 lakhs as per Globocon report. So this is the kind of
Okay.
exponential growth that we are seeing in oncology. Therefore, I think my primary focus would be in oncology going forward also for the next 7 to 8 years. Unfortunately, what's happening is the number of cases are increasing, but if you look at the number of doctors and number of beds, they are not increasing in proportion to the number of cases. That is the reason I think my focus would continue to be in oncology for the next 7 to 8 years. Coming to market,
Okay.
as I explained before, yes, initially there was a bit of effect, but then when people realize that oncology is more dangerous to neglect compared to COVID, then things fell in place for most of the oncology brands. And the second space I'm trying to work in is mid-level multi-speciality. This is a new space that I'm trying to cater to. This idea has come out more as a responsibility towards the society, responsibility towards healthcare, which has given me so much. Why I'm telling this is, if you look at Indian healthcare system, it is private healthcare system. It is mostly divided between corporate hospitals and nursing homes. And if you
Okay.
look at big cities, metros, or bigger towns, most of these corporate hospitals are located in the center of the cities or in the
Sure.
business hubs of the cities. Now, what is happening with day-to-day traffic increasing, cities becoming bigger and bigger, people coming from rural into the cities getting more day by day.
Okay.
People living in the peripheries of these cities are finding it really difficult to access these corporate hospitals because they have to travel sometimes 1.5 hours to 2 hours. Now, when they have so much of travel, what will happen in the emergency, they lose the golden hour, which would impact the overall treatment of the patient. So I thought this is one space where I should work in. I try to understand why people are not going to the nursing homes which are located close by to their neighborhood. Then I
Sure.
realized that these nursing homes not have infrastructure, they do not have good equipment, and because they don't have good infrastructure and equipment, doctors don't come in and stay there. Because of these three reasons, patients, though they have nursing homes next to their doors, they're not having confidence to get access to them, and they're coming to mid of the
Okay.
cities, traveling hours together to get access to the corporate hospitals. Therefore, I thought I would start a mid-level multi-specialty brand and
Sure.
do some space wherein the model is simple, where I try to start 100-bed hospitals across the peripheries, so that people don't have to come to the cities for treatment. And then coming to
Okay.
infertility again, like cancer, infertility cases are also increasing day by day. The latest statistics say that 1 in 8 couple find it difficulty to become parent. The reasons could be manifold. It
Mm.
could be because of lifestyle. It could be because of late marriage, postponement of kids, for career reasons. Whatever is the reason, the numbers are staggering. In 2017, while India did 2 lakh infertility procedures, in just 3 years' time, that is by end of 2020, these numbers have increased from 2 lakhs to 2 lakh 60,000. Therefore, I think this is one space I wanted to work in, but unfortunately, maybe because the space is new, we don't have international facilities available in India in infertility. Therefore, I'm trying to focus on
Okay.
this area. As a parent myself, I know how important, how beautiful it is a feeling for people to become parents. And when I see people struggling to become parents, I feel responsible to do something in this field. So that's how I started my to put my time in infertility also.
Dr. Sridhar, I have to take a very quick break on that note, but we're back in just a moment. Welcome back. You're with us here on Leaders of Tomorrow Weekend Edition. I'm in conversation with Dr. Sridhar of Omega Hospitals. You were talking about the space or the gap really between the number of patients and the number of beds in your answer. I just want to go back to that and talk about the fact that digitization perhaps is one of the things that will really bring that gap, bridge really the demand and supply. What are the trends that we're looking at when it comes to the healthcare space? I know it's a very broad brush, but in the interest of time, maybe just one or two top trends you can talk about.
See, I think again, it's a great question you have put in. See, every problem in our life will have a solution. At the end of the tunnel, always there is a light. Initial days of COVID, hospitals had real difficulty because patients were coming, loads and loads of patients were coming to the hospitals. Beds were not available. Waiting list was sometimes more than the number of beds hospitals had. What hospitals did to combat this is they have created a COVID team, and they tried to treat patients with minor symptoms through their digital platform through telemedicine. So patients who had
Okay.
small symptoms were getting treated at the comfort of their home. This team of COVID was talking to them over the phone, giving medication over the phone, and monitoring them over the phone. So this period forced hospitals to utilize digital platform and telemedicine to the best. What I was trying to tell is going forward also, post-COVID, there will be a lot of minor diseases for which patients will not come to the hospitals. I think we should continue this trend where in a country like India where patients are so many and then number of beds and number of professionals are less, I think we should utilize the beds of the hospital to treat and basic treatments we should encourage to get done through digital platform and through telemedicine.
Okay, I do want to talk about the role of the government, particularly for a space like healthcare, which is so closely watched by the government. Ayushman Bharat coming in as a big boost really for the healthcare pharma space. But do you feel there is much more perhaps the government should be doing, can be doing? What are your views on that?
I think Sunanda, there is no doubt that Ayushman Bharat is one of the greatest schemes government has launched, and through this they
Okay.
have brought healthcare, made healthcare more accessible to rural people. But what the problem here is, as I told you before, healthcare is not just basic need, but also basic right of the human being. When you talk
Sure.
about Ayushman Bharat scheme, most of the hospitals that are enrolled under this scheme are located in towns, cities, and metros. Now, what is happening for a patient living in the rural area, in the villages? They definitely have access to these corporate hospitals, but for that, they have to travel 500, 600 kilometers through buses and trains to come and reach these private hospitals. We don't understand that, but for the people who go through the trauma, only will understand how difficult it is to carry a patient who is sick 500 kilometers, 600 kilometers to reach a hospital. So I think government should do, apart from Ayushman Bhava, what government should do is to strengthen the basic government healthcare system. We have great infrastructure in place in terms of primary health centers, community health centers, district hospitals, and area hospitals. But for some reason in India, government healthcare is never on par with private healthcare. It's a different subject which I don't want to go into, but I would like to highlight maybe 2 or 3 reasons for this. One, government doctors not being compensated on par with private doctors, corruption in government. A lot of other reasons could be the reasons for this. But I think government should concentrate to develop government healthcare system strongly so that the people living in rural areas and villages get access to healthcare in less than 15 minutes or 20 minutes. That should be the primary goal of the government.
Okay, which brings me to my next question, Dr. Sridhar, and that's as far as the role of CSR is concerned. When it comes to the healthcare space, you, I understand, are very closely involved in areas like education and healthcare, of course. What is the role of CSR? Do you feel that a lot more people should be doing much more? And, just talk to us about the work that you're doing in brief.
Yeah, I strongly believe that you're not human if you don't do human service.
Okay.
I think you also agree with me that in the initial 15-20 years of our establishing time, we really get time to look back and do something to the society which has done so much to us. But what we also forget is, in these 15-20 years, we would have taken a lot of help from people around us, from the society, from the nature. And I think at least when you settle down in life, you should slow down, look back, and try to give something back to the society, something back to the people, something back to the mother nature, which has done so much to you. And I feel not only me, a lot of people want to do this, but basically what happens is they get lost in terms of time, they get lost in terms of how to do it, they don't have a platform to do it. Therefore, I thought if I do social service as an individual, I'll be able to reach only few people. So therefore, I thought I should create a platform wherein I can combine like-minded people like me and do bigger service to the society. And that's why Sridharani Foundation was founded 1.5 years back, through which we are doing some great work to the society.
Okay, I also do want to talk about some of the awards that you've received in your career. One or two of them which you perhaps hold, most dearly to your heart. What can you tell us?
There are 2-3 pride moments for me. One, when I received Champions of Change Award from the Honorable Vice President. Second time, when I received the Pride of Nation Award from the Honorable Defense Minister. And I also received International Excellence Award from Ms. Kareena Kapoor. The list is big, so I would like to say these 3 top the list.
Congratulations first up on all of these awards that you've won. But as we're running out of time on this interview, Dr. Sridhar, what can you tell us about any expansion plans you may have in the short term?
All the 3 branches where I'm working right now, they have huge scope for expansion. Coming to Omega, we have done great work down south. We have about 9 hospitals under Omega brand now. Now, next 2 to 3 years, we want to concentrate on north. Our Dehradun center is starting in 15 to 20 days time from now, and we want to add another 4 to 5 centers in next 2 to 3 years of time. Under Renova, as I said, I want to add mid-level multi-speciality hospitals across peripheries of Hyderabad to start with, and then go to other cities. We have 4 hospitals under this brand, and I want to add another 4 to 5 to cover the other peripheries of Hyderabad. And under Ziva, again, infertility is another area which needs a lot of concentration. The investments in this sector is less, therefore we have bigger plans. We want to add about 10 to 15 branches in next 2 to 3 years.
All right, my last question, you're an entirely self-made entrepreneur. Even as we're talking about empowering a billion dreams on the leaders of tomorrow as our overarching theme, any advice you'd want to give a viewer of tonight's episode?
One advice I would like to give to the budding entrepreneurs is always be positive. Keep your eyes and ears open for opportunities. I have seen in my life that opportunities will knock your door someday, and at that time you should be ready to grab them with both the hands. We should never try to copy the formula of somebody. Try to create your own formula of success. Try to be positive, try to be aggressive, and try to be patient. Definitely success will follow.
Wishing you all the very best. It's been a good conversation here with you today on the Leaders of Tomorrow, Dr. Sridhar.
Same here, Ms. Sunanda. Thanks for giving me.
We've run out of time on tonight's episode, but for those of you who are watching at home, if you have any feedback, our contact details is on your screens as we speak. Thanks for watching. Have a good night.